Hello guys, so my name's Dave. We're just going to be going through the bolt-on for the anaphylaxis. Going through, but I know you covered it a little bit already, but this will just be a bit more detail, and we actually have a go with the auto-injectors, the EpiPens and things as well as we do. There's a few things as we get started. Obviously, you guys have all registered already because you're doing this as part of your NPLQ, so this will appear online with your certificate as an extra part that you have done this. You do need to attend all of it, but for this part it is just today, so we'll do the teaching and then we'll have a little break, then we'll do the assessment afterwards. There will be some ongoing learning throughout the course. There'll be a few worksheets for them, but the actual final assessment will be at the end. I'll go through that with you then, and I'll tell you and make sure you know when that's taking place. So we're going to be looking at what actually anaphylaxis is and a definition of that. We're looking at what can set it off, so what causes it to happen, and how to recognise a casualty, so looking at the signs and symptoms, and then also looking at how that affects the airways, the breathing and the circulation. So that's when we looked at the bits previously, we said that's the important things that people need to be staying alive, so the clear airway, being able to actually take the oxygen in and that oxygen being pumped around the body. So we're going to look how anaphylaxis affects the different bits of those. So it is an allergic reaction, but it's not just a minor allergic, it's a fatal, potentially very serious, major allergic reaction that someone's going to have if they have this anaphylaxis reaction. It can be set off very quickly. It doesn't have to be necessarily that someone's eating, it could just be in the same room, and it could be quite a distance away from it, so it could be sort of someone's at one end of this room, at the other end of the room, and it could set that off still, so it's something that can come on really quickly and is really serious. So, in terms of things that can set off, has anyone got any ideas? We looked at Elizabeth earlier, something that you could have that would set it off.
A peanut allergy.
Peanut allergy, yes.
Insects.
Insects, good. Any others?
Allergic to latex or
Yeah.
plasters.
Latex, plasters, yeah. So there's quite a lot you got there, quite a lot common. It's not what I'm going to show you in a second. It's not a definitive list. It can be loads and loads. It can be something really specific. But these are some of the common ones that we have. So put them into categories. So you've got foods, nuts in general, peanuts specifically is a very common one, but lots of different ones. Milk, fish, shellfish. So some people can be allergic to shellfish and they're fine with fish, and eggs as well. Medicines, general anaesthetic, aspirin. Insects, of course, that's mainly bees and wasps, and latex as well. So where might we come across potentially some of these in like a pool environment? Any ideas?
The foods at the cafe.
Yeah, so foods in the cafe potentially. What about this bottom one, latex? What might that has latex in terms of maybe
First aid with the gloves.
Normally we would have gloves without latex, but some gloves can have them. What about in terms of maybe some of the swimmers you might have seen in the lessons, what are they wearing?
Swim hats.
Yeah, the swim hats, so they have latex in those as well, so that is something to keep an eye for. That's one of the particular things where you can find them. Okay, so if you turn to page 218 in the books. And then we're just going to have a look, the pictures in there as well, just to be clear for you to look at it closer. Just anything that you might see, silent symptoms, what obviously jumps out at you when you look at the photo there.
His lips.
Sorry?
His lips.
Yeah, so what's happening with them?
They're swelling.
Swelling, yeah? Anything else?
Rashes.
Rashes, yeah? Any other things? So lips as well, what else might be potentially swelling a little bit? You can see partially on there.
His throat.
On the throat, yeah, the neck. The general, so swelling is one of the main things. So on this, it's got swollen tongue. Can't fully see that in their face, but there's lots of different ones. Hoarse voice, so they're struggling to talk. Difficulty swallowing, difficulty noisy breathing, and they could feel sick. They could actually be sick, pain, and these are all signs that it is anaphylactic shock. But this can come on really quickly, and it will be sort of almost instantaneously. Someone will go from looking perfectly fine to like that. So it will be something that can come on very, very quickly as that happens. the symptoms. Swelling, it's not just limited to the face, it can be the hands, the feet as well, just generally with that. And you get the red itchy rash and a general flushing of the skin as well, so then going red. Because it comes on so quickly and it's going to swell into the throat, it's going to prevent them from breathing, it can lead them to having a panic attack and anxiety as well. So that's something else that you might need to be dealing with as well as the actual anaphylaxis itself. So it is extremely life-threatening if this happens. This is why we train to use the EpiPen. So most other things, you go and get it for them, and they administer it. With this, you can administer it because it is that important they get that auto-injector at EpiPen as quickly as they can. So you need to do that yourself. If they are capable of doing it, still let them do it, but you are allowed to, in this case, if they're not capable, use it for them. But this is the only one. You don't do that with other things that we looked at, so like inhalers and things like that, you can only get that for them. So in terms of the airways, going to prevent that air from actually getting, so you're going to get swelling of the lips, the throat, the tongue, and actually there'll be a wheezing sound from that. So it's going to very quickly swell up, make that airway smaller, and then not be able to get that in, which is then soon going to affect the breathing. They're going to have difficulty breathing, be a wheezing sound, they're likely to get fatigue because they're not getting that, and start to feel tired, and confusion from that. And then, as well as the actual oxygen coming in from breathing, it's going to affect the circulation. So having that pumping around the body, it can cause blood vessels to dilate, and then that has the other effect. They become weak, drowsy, floppy, and they're not able to necessarily, they could start to collapse as well due to that. So that's just very basic, just going over bits there. So what I'm going to do, you just take one and pass it around. It's just a little worksheet. In fact, can I just steal one as well? I'll get you my copy. So I just want you to have a go through. I'll read through it as we go through. I just want you to fill in just a few bits that you can add. So I'll just wait for those to go around. Everyone got a pen, yeah? So just close your books up quickly so you don't just copy exactly word for word as we do this. So first one, what is anaphylaxis? I just want you to write just in your words, just a brief. Doesn't have to be, so I'm not assessing this, I'm not worried about spamming things, just something to remind you so you can go through and read it and you'll understand. But just in your own words, so what you describe anaphylaxis as. And then underneath, I want you to, next one, just identify some of the common triggers we've looked at. So again, some of them are very similar, so don't just put general like food, put down some specific ones as well in that. So you don't need all of them, just a few of them in there. Good, okay. Underneath that, some of the signs and symptoms. So what we looked at in the photo there, just some of the key things you can observe or they can feel as well. So just fill those in. Don't worry if you've not put something against every single bullet point, every single number, just so you've got an idea of what they are. And then once we've done those, just in the bottom section, I just want you to just write a little bit about how anaphylaxis affects the airways, the breathing, and the circulation. It doesn't have to be exactly as detailed there, just a little note just to remind yourselves when you want to have a look back through this. Up. Right, so finish up. Has anyone got any other questions? Or anyone stuck on any bits of this?
The airway bit. So how does it affect the airways?
So in terms of you've got the contraction of the throat, the lips as well, so not letting that oxygen go. So the airway and the breathing are very linked.
Yeah.
For the community. So some of the bits.
That's what you breathe and it's coming fatigued and stuff.
Yeah, so this bit they put there through closing the airways, that bit can go up there as well. But yeah, that's fine. You've got the right, it's just separating that, got the right. Yes.
You know, for the circulation, you could just slow it down, basically.
So it's the dilating of the blood vessels, and then that's not going to let the oxygen come round as efficiently, which is reduced as it's coming in anyway, and then they could become floppy, collapse, and not confused and not with it. Everyone happy with that? Everyone got some, at least something in each bit? I say, don't worry if it's not entirely, you're not filled every bullet point, just as long as there's something in each one. Yeah? Good. Okay. So the next bit we're going to look at is actually using the auto injectors. So I'm going to go through the different ones, how to use them, the slight differences between them, and then what we do with them afterwards and treatment of the patient as well. So first thing you're going to do, you've identified the casualties and anaphylaxis, if you looked at your signs and symptoms, you've realised it, so you're going to position them in a way that's easier for them to get everything. So generally that's going to be either sit them down, might be that you need to lay them down if they do start to feel faint, then raise the legs up, around like we looked at with fainting. But just get them in a comfortable position. When we come to do this for the assessment, this is something I'm going to be looking for as well, so I'm making sure that you are, even when you're just pretending on each other with the training ones, that you are still treating casually, you're sitting them down and doing that. Don't just treat them sort of stood there as they're standing. Then you're going to ask them for the auto injector. So then they are going to say what it is, you can go and get it, or and they have it in the pocket and they'll be able to pass it to you. If they can administer it themselves, like we said, let them do it. So you're being trained to do it, you are capable of doing it, but you don't have to do it. If they can do it, let them do it themselves. But if not, then you can administer it. for the purposes of the assessment, we're going to say they can't do it themselves. So I want to see you do it on the assessment.
Yeah. Just so they're not talking about it. Would you have that if you needed that, and would you like something to let us know that they needed it?
What, beforehand
Yeah.
will there be?
Yeah, we're just saying that they can't talk, so it's like that. See if they can't do it.
Yeah, so if they might be able to sort of signal where it is, or sometimes if you are like, when someone might say like, oh I am allergic to something, they might tell you before it does happen just to make you aware. Some people do it medical conditions. Or it could be that it's not necessarily a member of the public, it could be a member of staff, so it's someone that you know that has this, and sort of have the pre-existing knowledge that they do have an EpiPen, they do carry an EpiPen or an auto-injector with them. And then, once it's been used, make sure you call 999. Even if you use it and they immediately start to feel better, you still need to call 999 because you do have the potential for those symptoms to come back. And you can say to them how that you've used it, they're starting to feel better, because that might alter your priority on how quickly the ambulance comes. If there's someone who, say, has it, there's two people who have one, and one of them the symptoms aren't getting better, then more the priority. But you still need to call the ambulance even if you've administered it and they're starting to feel better. So if they feel faint, lay them down, raise the legs, so that's going to get the blood coming back to the vital organs. Also means that you don't want them to faint and then hit the floor, potentially injure themselves, cause a head injury or something like that as they are doing it. If their condition gets worse and it alters, you can call the ambulance back. So call 999 back, say it's got worse, so that's going to alter. It could be someone's having it and they were breathing, and then it doesn't so much that they collapse and they stop breathing, in which case that's a very different casualty that you're dealing with. The ambulance is going to you much higher priority. Even though anaphylaxis is still higher than priorities, when they're not breathing, that's going to be the top reaction there. What would you do if that was the case, if someone was having this and it got to the point where they did stop breathing? CPR, good. So as soon as you get to that, you go to doing the CPR. You can give them a second dose of the medication after 5 minutes if it doesn't get better, or if the symptoms go and then they come back. You can only do this if they have 2 EpiPens, 2 auto-injectors. So these are single use. You can't use them once they've been used, that's it. So not like these ones where we clip them back in and we can use them again for training. It's just single use, that's it, once it's been used. So if they only have one, you've not got that one. It's only for someone who, generally it's people who have more severe, really serious reactions that will have 2 of them because they might need that second one administered. So if they go unconscious and you're sure they're breathing, you're going to put them in recovery position and make sure you keep monitoring the breathing, because it's very likely if they've got to that stage that very quickly they're going to go into a non-breathing casualty, in which case you need to start CPR. So just a quick bit, you know, either sit them down, lay them down, raise their legs. So for the medication, it will be their medication. You're not going to have, let's say if I was anaphylaxis or something, I saw some anaphylaxis, I'm not going to get my medication out and give it to them. It needs to be their medication. So that is going to check it's the correct one. The correct dosage. So all the information is on these. So it says all this, and it also tells you how to use it. So one of the things I'm going to be looking for is that you actually read the instructions, what it says. So all the different ones have got it printed on, but that's something I want you to do, even as we're doing this. And even if we're going to go through it anyway, but I still want you to stop and look and read the instructions. That's something I'm looking for. But it's all printed on there. Also, if it is in date, so the real ones will also have a little clear window so you can see the medication inside. And if it's gone cloudy, that's an indication that it's not suitable for use anymore. But there'd be a little thing explaining that on there. Well, people don't have it because they don't have the medication, and obviously they're just training ones. So using it can go through clothing, can go through leather. What you don't want to be doing is, say someone's got their phone in their pocket or their wallet in there, and you stab it in there, because if you do that and you don't actually go into them and it say injects it into their wallet, it's one use, so they've not got that anymore, they've not had that medication that they need, so you need to make sure it does go into the person, not into anything else. So just be careful, you need to check the injection site where you are going to do it. And as you do it, it's going to be in the upper part, in the middle of the outside, so there or there. Generally, it doesn't matter which leg we're going to do, unless there was a reason you couldn't get to one of them, so they had another injury or something blocking it. Do that one. If you're administering a second one, so you've done the first one, and then you have to administer the second one because 5 minutes has gone past, the symptoms have started to come back, then if you can swap over, do it in the other leg. But if you can't, just still, it's more important to get this in, but if you can, swap legs at that stage. So you've got, if you look in the books as well, there's some pictures of them there on 219. So you've got a few different ones. So you've got this one, which is the EpiPen. This is the one that's sort of more commonly everyone heard of. So technically they are auto-injectors, that's the overall term. EpiPen is a brand of auto-injector, but it is just go on. So I'll just pass a few of the training ones round, just for you to have a look at. Then you've got the Jext, which is this one. If you look in the book, well on the screen, you actually see there's two different Jext ones, and if you look, they are for different weights of casualties. So they're generally the small one is for young children. So that's why it's important that it is your EpiPen, not someone else's EpiPen that is being used for the. So just pass them around to have a little look at. And the last one is the Emma training one. So we're going to look at exactly how to use all of these, but just so that where they are, the different brands of them. These two are both quite common in place. These ones are slightly less common, but there's still the chance that it could be one that you come across, so you do need to use those. A few of those. Just pass them around and have a quick look. Let's have a volunteer. Who wants to go first? Go on then, there we are. Cheers, you.
James, go on now.
Yeah, if you bring that one with you as well, 'cause that's the first one we're going to. Go on. So what's the first thing I'm going to do? So I've identified Louis having an anaphylaxis reaction. What am I going to do first? Position. So you just sit down there for me. I'm going to locate. So in this case, he's got the EpiPen. Now, as we go through this, quite a few of these are the same, some of the same steps or very similar steps. So if you're not sure, like I said, the instructions are all on here. So whilst we're doing this, look, read what it says. So first one, I'm going to hold it in my dominant hand. Then going to remove the blue safety cap. So with this one, we take the cap out this end, and it's the other end, the orange end, that we use. So then you go from 10 centimetres away, and we're jabbing for 3 seconds. So we go on the upper outside, and we go like that. 1, 2, 3, like that, and it will pop up like that. Yeah, and that's it. Nice and simple. So with that one, that's it at that stage. Okay, so for a real life one, it will pop up and cover it like that. You won't be able to push it back in. For our ones, these are training ones, you just squeeze the side, click it back in, and then put the cap in the top. Okay? So should we have another volunteer for the next one?
Yeah.
Anyone else want to have a go?
Oh, no.
Yeah. So just with these ones, the Jets ones, they do have a little plastic pretend needle, so you might feel it poke you a little bit. It's not a real one. I've not just injected you with something. It's just a little plastic one that you will feel. So start off with dominant hand, same thing. So prep removing the yellow paper cap. So same as the EpiPen, you take the cap off this end. It's the other end that you're going to use. And then you're gonna, this time you're gonna just push it in and hold it for 10 seconds. So I'm gonna check the side, check this in his pocket, and go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pops up and covers it again, and then on this one, you're gonna massage the injection area for 10 seconds. So just rub over it 10 seconds, like that. Okay? Then one more volunteer. And for this one, you just click it back in and pop the cap on the top. You gonna volunteer for me? So what do we think the first one's going to be with this one?
Take the cap off.
For that, what was the first one, the other two? I'm going to hold it.
Dominant hand.
Dominant hand, yeah, good. So holding the dominant hand, prepare, move the needle shield. So this one, you take that end off and it's the same end that goes in. So just be careful with that. What I don't want someone doing is getting it mixed up and say this one, taking it off and then going like that, because what's that's going to do? It would go into your thumb rather than to the person. So we definitely don't want that happening, because it could be for someone who's not, actually it is potentially dangerous for you for that to happen, as well as them not getting the medication. So just make sure you think with those two, it's the opposite end with this one. You take it off, it's the same end. And this time you're going to just push it in for 5 seconds. So you're going to check. See, he's got something in his pocket there, so I'll come and just do it this side. Just I got something in that pocket as well. So 1, 2, 3, 4, 5, and then you're going to massage 10 seconds again. So that's the same as you'll just rub over it gently for 10 seconds, and that's it. You're done. So if you've used any of those, what do you think the next thing you're going to do once you've used it, you administer it to someone?
You call the ambulance.
Call the ambulance, good. So if you've got 2 people doing it, someone else can call the ambulance whilst you're doing it. If you're on your own, do this first, then call the ambulance, because this is really important. It goes as quick as it can. Still, it needs to be like a few seconds, then call the ambulance, not waiting for it. But for that, you want to do this first, then call the ambulance if there's no choice of calling them at the same time or someone else doing it. Right, what we'll do there, we'll just get into either pairs or one of you have to go to 3, and just have a go using these on each other. So there should be enough so that we've got enough for each group. Just swap round so we have a go with all different ones, and I'm going to just come round and watch, just check you're okay with them. So you 2 want to go together, you 2 want to go together, you 2, then you guys want to work. There's a 3. Has anyone in those groups not got one?
Yeah, we haven't got it.
Yeah. If you have that one to start off with. Anyone else need one? You've got one. I just position these. There we are. And there's a spare one.
Is that the one with the short safety glass?
Yeah, you can do if you want. That's, yeah. Yeah, there's nothing in it, so
Alright, we do you first, because we've got it.
Do it. You're not standing.
I try to do it in the outer. That's it.
No, I'll do it.
So you have to do the
So I've set it down in the position.
Well, let's have a quick look at you guys.
I hold it in my dominant hand.
Go to the bottom.
Move them down. And I need to check for anything in his pockets. So it's still there, but like it's inside.
That's it.
It's 10 centimeters.
Just think how long we're doing it in that one.
I know.
Which is this yet?
Yeah.
You went
The one's the end one there.
and Jackie.
So if you have a quick look in the little church, oh yeah, it was on there.
30 seconds.
30 seconds on that bit. So 10 seconds that bit was right.
Yeah.
So you just say, you know, no, not sure, remember it's on the instructions there as well.
Same one.
Yeah, it should be, yeah.
Basically, first one ain't worked.
So what we did was we injected it.
That's a class, please.
Yeah, good. Go on, let's have a look at these on
And use the slide.
This one's only going to maximise.
Push it straight in.
Read out all the instructions.
So these two pushes, that one you won't.
How far about it? So that's about
It's well, I mean, if you do 9 or whatever, it's not going to put
So about that.
That's rough.
Yeah, like that. You ready?
Push it.
That's it. Now, so hold it for 3 seconds. Good.
And then
Remove
What's
the
down on
safety
the
cap.
So that one you don't need to.
oh,
We do 10 centimetres.
Good.
Yeah.
Okay, swap them out so we have a go with some different ones rather than just using the same one. Make sure you put all the bits back as you do it as well.
I have to make it. You have to flip it.
That's it, good. So reading the instructions, excellent. So for this, those two are the same. It's just that's the one for the of a child that's say 15 to 30 kilograms. Person weighs there. So yeah, you use that the same as that one. It's just that that's for the child. That's it. Good.
First seven, then.
This one here, what's it?
Probably the knee.
Not too bad.
Good.
In your hand.
we need the jets, please.
Do anyone need any of the other ones? Not had a go with them yet? Yeah.
Yeah, the white.
Until the camera.
Yeah.
Do you?
Years ago, yeah.
You do me after?
Just the jets.
Doesn't
Yeah. So just swing that
No,
one.
you do it on me.
Yeah.
Have you ever done it?
No, use this one, yeah. It's fine, you do it. Well, we'll use it.
Then just with this one's put on especially, make sure you do actually put enough foot. It does require a little bit of umphrightness. If I just take this off and just do that, it's not come out, it's not work. So make sure it actually enough force to make it click in and then pop out like that. Okay? Is everyone reasonably happy with all of those? Everyone had a little go with all of them? Good. Okay. So, once injected, what do we say the first thing else we're going to do? Before we say after we've injected them, what's the first thing?
Cool.
Yeah, call 999. Then reassure, monitor the casualty, so you need to check are the symptoms going, is it getting worse, is it staying the same? And then that repeat dose can be administered, if available, as not always at all. So then, once the ambulance arrives, the healthcare professional arrives, what information do you think you would include as you're sort of passing that information over to them?
How many times you've done it?
Yes, if you've done one or two, good. Anything else?
What their names?
Yeah, no, if you're able to talk to them and get that.
Maybe the type of thing you use.
Yeah, to the one you've used. So we'll come back to the actual EpiPen itself in a second. Yeah, if you know what caused it as well. Yeah, so some of the basic, don't forget the basic things. So the casualty's name, like you said, what happened, what first aid has been administered. So it might not just be just that. If they've say collapsed in it, then you might just make sure you tell them that they've done that as well. Pass all the information on. One or two auto injectors. If they remained conscious throughout, so have they gone unconscious and been put in recovery position at any point? Have they potentially fainted as well? Have you laid them down? What do you think we're going to do with this once it's been used? Any ideas?
In a sharp spin.
Yeah, so in a sharp spin, good. So anything like that. That's why when this pops up, it covers the needle, so you won't be able to push a real one back in. It will be stuck like that won't have those side bits to click it in. That protects you from catching it on anything or something. So you can go with a sharp spin. There's something else you could potentially do with it. Anyone that got any ideas? You could maybe give it to.
The person you just injected it into.
No, not quite. So it might go with them, but with
With the ambulance.
the ambulance crew. Yeah. So one you might just be able to go, there it is, and then they know exactly what's been administered. They've got that there, and then when they dispose of it, we sort of at leisure centres will have quite a small sharp spin. They have loads and loads of needles and things, so they'll just have a big, massive one that they can dispose of it in their own. So it will end up in the sharp spin eventually, but you can give it to the ambulance crew when they arrive as well. So that's the two options with that. Anyone got any questions before we move on to the next little bit? No, good. Okay then. So we have to get on our feet for this one. So if you want to come and grab a whiteboard pen quickly so I can set this up.
What is in everyone gets a pen?
Yeah, it should be enough for a pen each. I think one of them is yellow as well, so that one might not show up very well. So don't use that one. And if we close the books up for this bit as well. Okay, has everyone got one? Or anyone else need one? Good, okay, what we're going to do then? Two. I just want you to come up one at a time and fill in a bit for what we do with these. The differences with each one. So the bit at the top, so the bit so before you get to the blue line, is what you're going to do with the casualty before you administer the auto injector. The bit Once we get to the blue section, is actually administering it, and the green section is what we're going to do after we've done it.
Stick on the road, innit?
So, on your feet. So the top section is what you do with the casualty. So all the steps, or what you do before you actually administer the auto-injector. Blue section is administering it, and the green section is, so these are the same for all three, so you just need to write it in once, but some of these are different, so I want to see the timings and if there's any distances or anything. So I want everyone to come up and just write in some of the bits.
What's the top say holder and that?
So we'll go on. What's the first thing we're going to do once we found someone? We've said yeah, definitely
Position.
anaphylaxis. Yes. So how are we going to? So just write. Do you want to do that one? So write on there.
Yeah.
Yeah, just in that top bit. That's the same across all of them. So how are we going to position them? So go on. Next person will have. What are we going to do position wise? Do you want to go?
Don't you lay them down or put them in like a comfortable position?
Yeah, so comfortable ladle, sit them down, good. So once we've done that, we'll work on this actually. So what's the next thing we're going to do? You've got the casualty sat down. What's the next thing? Any ideas?
I'm going to ask them if they've got an EpiPen.
Yeah, good. So you're going to locate it. Do you want to come and write that one on?
I'm writing it here.
Yeah, next one down. So you've got the EpiPen. What's the next thing you're going to do? Before you get to that stage, read it. Good, yeah, do you want to come on? So what sort of things are we in this one there, sorry? Just this box here.
This one.
Yeah. So what sort of things are we looking for with that?
Would you ever have to ask for consent to provide a form, like administrative?
Yeah, you can speak to them and ask for consent to that. Obviously, if they're at the point where they can't respond, you can, same with all, let's say you're not necessarily always meant to get it, but yeah, you still ask for that. So we're going to read it. What are we looking for when we're reading it? Instructions. Anything else? Yeah, so that'll be on the instructions. What else could be potentially a problem with it?
Which end of the cap?
Expiry date, yeah, so all those sort of things as well. What did you say?
So which end of the cap is not what?
Yeah, so you know which end is, that is correct. Yeah, do you want to put that on there, sort of? Expiry date. So you've read it, it's fine. So what are you going to do next before you start administering it? Yeah, you've got them set down. There's something else you need to check before we.
Is it for the pockets too?
Yeah, pockets, good. Do you want to come pop that on? So check the pockets, check the injection site, not just go straight for it. Okay, so next bit is split into the section. So I want you to come around and just start filling that in now. So the blue section, so underneath this one, each step, underneath that one, each step, underneath that one. So that one's crossed out, so don't put anything in that one because there's a step you miss out. So if you guys want to go around and start filling those in, you can talk to each other, help each other out as you're doing it.
3 seconds. Is that one 3 seconds? That one's 10 seconds. That one's 5 seconds.
Hold this for 3 seconds.
I think that one's 3 seconds. That one's 5
It
seconds.
says it's 10 centimeter. Okay.
Firmly again for 3 seconds. The thought.
That's right, so when you can start filling in this side whilst they're doing that, you can
3 seconds.
crowd around and fill it in.
Start now.
That's it, and once you've written one thing on, if you come off, and then let some of the people who can't quite get to the board in. don't, I say I'm dyslexic as well, don't worry about spelling names, just so you've got an idea of, like, I'm not worried about spelling.
I think for 10 seconds.
Yeah, no, I don't think. Yeah, that one was. No. All it says is take cap off, then whatever that is, and then you're going to 3 seconds, 50%, that's all. But it doesn't look like it, does it? Both up against 3 seconds, it should say.
So we've got nothing written in this top row. What do we think the top thing is? What was the same with all of them? No?
Breather.
No, 4. What's the first thing you do with the wholly dominant hand, yeah?
Oh, so we put
So-
it in the wrong boxes.
Yeah, that's meant to be in there. Just put a little arrow just to show that's fine. Yeah, does someone want to come and write that in? Dominant hand on there?
No, it's just what's to do.
Yeah, that's this one, yeah. Okay, so there's a few little bits missing. So we've got massage 10 seconds, good. 10 seconds. That's for this one. Is that 10 seconds? 5 seconds, yeah. So which one's 10 seconds? Middle one, yeah. Someone want to come write that down? And just. That's 5. Right, this. What's the bit we're doing here to prep the medication? See? Yeah, take the cap off. Good. So, which cap are we taking off? Yeah, go on. So have a few of you come in. Just write it in. And whilst we're doing that, we've started filling this in. Call the ambulance. A couple of other things we need to make sure we do.
What did you say to us?
So for this one, which caps we're taking off? So this one, what we're taking out? Blue one, yeah? So call the ambulance afterwards as well. What else we need to do with the casualty? Reassure and monitor them, yeah? Because if something alters, you need to be able to deal with whatever the situation is, whether it be they start to get better, or it could be that they get worse and they stop breathing. So you need to monitor them, keep an eye on it. And what else might you have to do? Yeah, so we get them again. When will we do that? Can everyone remember?
After 5 minutes.
5 minutes. If
Symptoms come back.
Worsens.
yeah, it gets worse or come back, or they leave and get better. Yeah? Is everyone reasonably happy with all of that? Good. Okay, if you want to have a seat again quickly for me. Yeah, just drop them on there. Thank you. So, does anyone have any questions with regards to any of those bits, whether it be identifying it or using the auto-injectors? Good. Okay then, what we'll do, we'll have a little break there quickly, and then we'll come back and do the assessment in a second, okay? So, Joanne, can we start filming that?